1-minute video is to give you a basic explanation of the Perrin Technique theory as to why people develop the conditions ME/CFS, fibromyalgia or post-viral fatigue syndrome. I will then briefly talk about how the Perrin Technique works and what happens in treatment. A word we mention a lot is the word toxins, and for simplicity, when we talk about toxins, we are talking about any substance that is harmful to the body. We come into contact with hundreds of toxins every day. Some examples are chemicals such as those found in cleaning products and pesticides in our food. Toxins can be produced by the presence of viruses and bacteria. Due to the COVID-19 pandemic, you will have heard of a cytokine storm triggered by the virus, which is a harmful overproduction of inflammation. We absorb toxins into our body via our respiratory system, through our skin, and also through absorption within our digestive system. A healthy body has an efficient process to rid the body of these toxins. They filter through the walls of microscopic blood vessels into our blood, where they get circulated around our body and taken to our primary organ of detoxification, our liver. The liver has various ways of doing this, such as breaking them down, eliminating them through bile, or repackaging them into a safer form. We can then safely excrete the waste products through our kidneys, bowels, skin via sweat, and lungs via our breath. The blood vessel walls are like a fine mesh, so tiny toxins can filter directly through. However, many toxins are too large to be able to fit. This is where our secondary drainage system comes into play, our lymphatic system. Lymphatic vessels open up a bit like the gills of a fish, where they can engulf any size of particle. Once in the lymphatic fluid, they are transported by a pumping mechanism of smooth muscles in the lymphatic walls and are started to be broken down. All of the body's lymph is transported to two main drainage points just under the collarbones, and once here are absorbed into the blood, where it can be transported to the liver. This pumping mechanism is controlled by a part of our nervous system that deals with the automatic functioning of organs such as the heart, kidney and bowel. We know it is vital for healthy lymphatic drainage. These nerves, called the sympathetic nerves, spread out from the thoracic spine to all points in the body, and are ultimately controlled by a small site in the brain called the hypothalamus. The only part of your body that doesn't have a lymphatic system is your brain and spinal cord, but toxins do enter this region, so how are they eliminated from here? They drain along tiny gaps next to blood vessels, which travel through little holes in the bones of the skull on either side of the 12 vertebrae of the thoracic spine. Here they are swept up and drained into surrounding lymphatic vessels. Once in the lymph, they are pumped into the direction of the collarbones, drained into the blood and broken down by the liver. There are many causes of a disruption in this process. Some people are more prone to developing problems, and usually it is a combination of reasons leading to a breakdown in the process. Ultimately, this disruption leads to a buildup of toxins within the brain and spinal cord, the central nervous system. I'm going to talk about the three main causes: exposure, stress and structure. A buildup of toxic exposure or a sudden large exposure can cause the lymphatic system to be overloaded. An example is working in a chemistry lab or contracting multiple viruses. A problem with the part of the nervous system that control the lymphatic pump can cause a slowed down lymphatic drainage, and often there is stress on this for many years before the onset of signs and symptoms that something is wrong. Ordinarily, when we are going about our daily lives, for the majority of the time we should be in a calm, rest and digest state, where the automatic bodily functions such as heart rate, digestion and the lymphatic pump are just ticking along. However, imagine you are crossing the road and last minute you see a car coming towards you beeping its horn. This is where your ingrained survival instinct kicks in, your fight or flight response. Your nervous system instigates a surge of adrenaline, causing a chain of events which are aimed to prime the body to be aware of its surroundings and be ready for action to escape the imminent threat. Your pupils dilate to optimize your vision, your heart and breathing rate would increase, providing your body with energy and oxygen. The blood supply is directed to your muscles and they tense up ready for action. Once the threat has passed, it should take around 20 to 60 minutes for the body to return to its pre-arousal levels. During this short time frame, some automatic functions are temporarily reduced or switched off so all of the energy is aimed at escaping the danger. One of these functions is a lymphatic pump. Unfortunately, numerous or ongoing stresses within our daily lives can cause a disruption to this response, causing the body to think it is constantly under threat. This causes a chronic disruption to the lymphatic pump. Stresses can be low level but daily, such as anxiety related to a bad relationship or a stressful job role. It can be more sensitized due to big traumas such as sudden bereavements or being attacked. Stress can also be physical in nature. Infections, postural stress, operations and injuries are examples of these. Anything affecting the drainage pathways from the head or thoracic spine can cause physical barriers, reducing the efficiency of drainage out from the brain and spinal cord. Examples of this could be from a trauma to the head, or spinal stiffness caused by an old injury such as whiplash. Even a genetically flattened spine can lead to less efficient drainage. Having all three of these factors is a bad combination, and one has a knock-on effect to the other. Often there is a memorable final event such as a shock or a virus that triggers a long-lasting illness such as ME, CFS, fibromyalgia or post-viral fatigue syndrome. This vicious cycle leads to many symptoms I'm sure you'll be familiar with. Severity and number of individual symptoms differ from person to person, but this is a few commonly experienced. In the condition fibromyalgia, the same process has occurred in the body, but widespread pain is a dominating symptom. The Perrin Technique is an evidence-based method founded by Dr. Raymond Perrin. It has been used to treat thousands of patients for over 30 years. Alongside health history, it is an accurate and efficient aid to diagnosis and treatment. Here at the Village Osteopaths, we have over 16 years of experience successfully using the Perrin Technique. If you are interested in whether the Perrin Technique can help you, the first part will be a video or phone call where an in-depth medical history is taken. The second part of the consultation will be in our clinic in Timperley, Cheshire. You will have a physical examination to detect the presence of 5 physical signs indicating lymphatic congestion, structural issues, inflammation and nervous system irritation. Depending on your physical signs, we take into consideration your symptoms, length of time you have had the symptoms, quality of life and any other health conditions and advise you on your diagnosis. If the diagnosis occurs with one of ME, CFS or fibromyalgia, we will use these factors to calculate a score out of 10. 10 being full health, this score is a guide to severity and prognosis, and based on this we can give you an estimation on how long your treatment plan is likely to last. To reverse this vicious cycle, we need to get your drains draining, put out spinal inflammation and help your body rid the build-up of toxicity. Our specialised practitioners work with hands-on manual treatment. Central lymphatic stimulation does the job of the lymphatic pump. Gentle spinal techniques help to minimise any structural strain, and cranial work aims to calm the central nervous system, rebalancing it into a more parasympathetic rest and digest state. The ultimate aim of treatment is to put your body back into a state of health and balance that it can maintain once more by itself. There are a number of things we ask you to do at home to give you your best chance of recovery from the Perrin Technique, which will be discussed more in your consultation. These include a daily home massage routine, advice on nutrition, and the highly important half rule. The half rule applies to physical and mental exertion. Basically, whatever you think you can do without a payback, you only do half of this. This can be hard to judge, so another way of thinking about it is to think double. Only do something that you think you could comfortably do twice. In the early stages of treatment, it is not uncommon to experience side effects. Dependent on your score, this can last for some time. This is a good sign that the treatment is working, and your osteopath will advise on ways to make them manageable. As you carry on through treatment, symptoms such as fatigue should gradually dissipate, and hopefully that payback from exertion should be a thing of the past. At this stage, we will be looking to gently and safely increase your activity to build fitness and increase stamina. but it is important we do this at the right time so as not to lead to boom and bust. Everybody's road to recovery is different, but for some a level of ongoing management is needed. For others, a full recovery is possible. Our ethos here at the Village Osteopaths is to do all we can to help you reach your potential and reclaim your life.